Hey, everybody. Welcome. Live from Chicago. It's the Sports Doctor. I'm Dr. Bob Weil, sports podiatrist, brought to you by Lower Extremity Review and MVP Parent Magazines, School Uniforms by Tommy Hilfiger, Right Fit, Fitness, Wellness, Performance, and Vestibular Training Products. We've got a great doubleheader today. Dr. Tammy Penhallow. She's an osteopathic pain management and regenerative medicine physician. She's going to touch on the obesity concerns with the virus, with COVID-19. And then Dr. Matt Barkoff, he's a fellow podiatrist, podiatric foot and ankle specialist. We're going to be talking about podiatry's role in sports and fitness. Then it's a sports doctor's in and emails. First, let me welcome Dr. Tammy Penhallow. Again, an osteopathic physician. She's had quite a career in the Navy, in the world of sports medicine, pain management. So, Dr. Tammy, welcome to the Sports Doctor.
Thank you, Dr. Bob. It's great to be here.
Give us some background on you and your career.
Okay. I did medical school in Kirksville, Missouri, internship in Spokane, Washington, and went immediately active duty with the Navy as a general medical officer, which is kind of like a family practitioner for a battalion of 720 people in Kosovo. Had a 12-year Navy career where I lived all over and practiced all over the world, including a couple of years in Spain and a couple of years in Japan, and deployments to Kosovo, Guam, and Djibouti, Africa. And I'm an anesthesiologist, trained in the Navy at Walter Reed National Medical Center in D.C., and I did a pain fellowship in pain management at Stanford University. And now I've got my own regenerative medicine practice, and I'm still doing some anesthesia here in Phoenix.
Where are you?
Oh, okay, Scottsdale, Phoenix area. Yes, sir.
Okay. Is it still 120 degrees there?
No, we're just about right in the high 90s, low 100s. So it's starting to turn the corner.
It's like absolute, like perfect weather. The area of pain management, the area of pain, we talk about it a lot on the Sports Doctor, the nightmare of the whole pain pill scourge that we're still in the middle of really, really dealing with. And the exciting parts of regenerative medicine and sports medicine. We talk a lot about medicine from around the world, complementary medicine, Eastern and Western cultures, and it sounds like you've actually experienced some of that. But one of the things we wanted to touch on today with the virus and COVID-19 is this real concern with obesity and that connection. Give us some comments on that.
Okay. I can comment both as an anesthesiologist and a pain doc. When I'm doing anesthesia, I see an average of 30 to 40 patients a day as I'm screening them for outpatient endoscopy procedures like an EGD or a colonoscopy. And I keep stats. And over 43% of my patients in these outpatient centers have a body mass index of greater than 30. So that qualifies them as obese. Over 8% of those are considered morbidly obese or a body mass index greater than 40%. And then I'll roll in not just the outpatient surgery center, but I also do some work at the Mayo Clinic, and that's where I see patients with a body mass index of over 50 or over 60. And that consists of 2% of my patients. So it's not a small number. If we're looking at an overall obesity rate in the United States close to 50%, I've got 43% in my practice. Yeah, it's crazy.
Dr. Tammy, I've been talking about childhood obesity on my show for 25 years, give or take a few weeks, as well as general obesity. And already there's whether it's physical, joint problems, all sorts of problems with the obesity, being overweight, whether it's the whole mental side of things, where we've talked about the belittling and the problems and the bullying that children go through, and things like diabetes and high blood pressure and all of these things. And we are still in a mess with that stuff, with obesity.
That's an epidemic. It is an
Yes.
epidemic. We're in a pandemic right now, but we've got an epidemic in our country with obesity. And as it relates to the pandemic, we've shown, Columbia University has shown that if you are morbidly obese, a body mass index greater than 40, you are more likely to be intubated and to die if you're less than 68 years old. Normally we say this is a disease of the old people. It's the people who are going to die are those greater than 68, but not so if you're concerned, and I'm really worried about my patients.
This is one of the reasons we wanted to have you on. Absolutely, when we're talking about fitness and wellness and the ability to try to stay as well as we can, try to have our immune system be as positive in effect. And of course, we know that exercise is so important about that. And obesity has always been this gigantic, pardon the pun, elephant in the room. And we're very familiar with that. And the big surprise to a lot of people, including medicine, is what you just said. Wow, this becomes a real concern with the COVID virus, which is it's as bad as somebody who might be a diabetic. They're talking about these secondary underlying conditions and how dangerous that could be, especially in the older population. And then you'd say, but holy cow, half the population is obese. Even though the body mass index between me and you could keep as far as its relevancy. Some of the best athletes in the world, when you measure them, they come out as obese, with that BMI index. So I've never been a giant a fan of that, But when we talk about this connection, this is a big educational challenge, it seems, isn't it?
It really is. It's that you might think there's nothing wrong with these people other than that they have obesity, but they just may not have manifested outwardly the signs of obstructive sleep apnea, hypertension, diabetes, or coronary artery disease. So when they do get sick, and then we're looking at something that affects the lungs and the ability of that diaphragm to move, and you've got the abdominal mass on the diaphragm preventing it from moving, amongst other metabolic things going on, that's how you see that the pathophysiology can work and that these patients can then be gravely affected by the virus, as they were in the H1N1 and the other flu pandemics of the early 1900s.
Yeah, that's a surprise to a lot of people also. Everybody, you are listening to The Sports Doctor, Dr. Bob Weil, sports podiatrist. Go to my website, sportsdoctorradio.com. If you go to radio shows, you can go back close to 10 years, people from all over the world, all sorts of different great topics. You could listen to whatever you would like. I think before that, we have to find the reel-to-reel stuff somewhere in a closet. But if you want to go over to newspaper articles and magazines, you could read an endless array of articles on everything from the world of concussions to the challenge of youth sports to what's the best shoe to one of my most popular articles, Women in High Heels Accepting the Challenge. We have over 30,000 followers on Twitter. I can't tell you how many guests I get from Twitter, maybe 10,000 on LinkedIn. We get a lot of guests through those communities, and you could follow us. We have great information on those vehicles at Sports Doc, DOC Radio. We're talking to Dr. Tammy Penhollow, osteopathic physician, regenerative medicine, pain management, the anesthesiologist. And the anesthesiologists really become the experts in the world of pain medicine. Now, you were quite an athlete. Maybe you still are yourself. I know you had quite a bit of action in the world of sports medicine. Regenerative medicine is such a big deal. Talk a little bit about that.
It is a great thing for athletes who don't want to undergo surgery. Surgery can potentially be career-ending. We're talking high-level athletes and elite athletes, and a lot of even our everyday weekend warriors don't want to have to undergo surgery. So what we found with regenerative medicine, as I'm sure so many of your guests have touted, that people are able to return to play faster, and they're using their own cells. They're using either bone marrow aspirate concentrate or they're using PRP. And these things are not considered performance enhancing. It's not blood doping. It's not going to get them in trouble at the Olympic level or any other level.
It's only performance surviving. That was
exactly.
Yes, I've renamed performance enhancing drugs over the years to, don't tell anybody, performance surviving, which many times is when these athletes fall into the trap. I've got to play, the crazy schedules. And again, the world of pain management has exploded, times 100. Thank God, with many, many new alternatives to the opioid scourge that we're still in the middle of. And the idea that, again, no side effects when you're using parts of that patient's own body. Yes. And you're using some of these stem cells or protein-rich plasma where you are not dealing with the nightmare of side effects. That alone seems like a gigantic, big deal. Dr. Tammy, what website or where could people go to find out about you and what you're doing?
The practice website is Precision, PRECESION, MED.com.
Okay, and again, the situation of, you mentioned it, the weekend warrior. Everybody wants to stay active. They want to stay healthy as long as they can. And many times we see, again, that we start running into all sorts of overuse problems. And it's exciting to see that sometimes regenerative medicine can be helpful also in some of the younger populations when you're looking to calm down some of these chronic, joint problems. Because, again, the situation, one of the reasons that I co-wrote the book, Dr. Tammy, hashtag Hey Sports Parents, was the epidemic, in capital letters, with youth sports overuse injuries. I'm sure you're in the middle of that because you worked with a lot of different teams and whatever. Did you coach or were you the team doctor? What were you doing?
In medical school, I was the president of the sports medicine club, and we were the team docs for all of the high school, junior high, and college teams in Missouri, where we were at in Kirksville. And after that, it was just more of a participant or doing the coverage at a marathon or those kind of things, just to keep my feet wet and to keep myself in it. So, yeah, I see a lot of athletes that way. And another good thing about regenerative medicine in the athlete is you are using their own cells, not corticosteroid. More and more studies are coming out showing that knees that have had steroid in them are more likely to go on to a TKA or a replacement than those that have not had steroid, not to mention bringing it back around on the effect of corticosteroids and suppressing the immune system and the COVID, and now flu on top of COVID.
Yes, it's interesting, of course. Cortisone has always been one of the magic ingredients. Injection of cortisone, one of our most powerful, mostly safe. We ran into trouble when it started being repetitively used because it worked. And it ended up being degenerative, which I think was a surprise to some of these athletes over the years. I had 20 injections in one knee, I had 15 injections in the other knee, and the cartilage is shot, everything's worn out. So the ability to have healthy aspects, I think, is one of the most exciting things we would see. How young in the population do you feel regenerative medicine can apply? When indicated?
When indicated, I can see it in the teens. We've got these kids that go, for example, the soccer farms, and they've been placed into these rotations where they move away from their family and they're just working towards becoming a professional soccer player or football on the other side of the pond. And I know that they're starting at that age.
Yes, and many times we see,
reject them.
Mechanically, with half of these kids, what you need to do, this is my pearl for the week from the sports doctors, you got to pay big attention to foot mechanics. You got to pay big attention to the role of orthotics when we're dealing with some of these chronic overuse problems. where we start to see that we're not paying enough attention many times to biomechanics. Is this kid in the right shoe? But it is interesting to see and exciting that part of some natural ways to be able to calm some of these overuse injuries down. Of course, at the same time, cutting back on the schedule, I call it intelligent rest, is always a tough sell. And especially, again, in your world, where you're dealing with the individuals from A to Z, even in the obesity world, that's why I ask you, how's your psychology skills, Dr. Tammy?
So much of this is about that. And when I look at my obese patients, I have to think, are they even a good candidate for surgery, even if they've got an orthopod saying, I want to replace your knee, but at a BMI of 58, they are an extremely high risk for A, the joint to fail, and B, just for undergoing anesthesia. So a lot of surgeons won't think that they're a good risk for surgery. How I look at it and speak with them and say, wow, what's the primary goal? To get you moving. There's nothing wrong with your platelet-rich plasma right now. There's nothing wrong with your blood. We can still draw that, spin it down, and precisely deliver it to the knees, get you moving, working towards strengthening and weight loss. And that starts the cascade. It starts a very large, big ball that rolls down the hill fast and gathers momentum. And that may be the impetus that changes everything for them. But do I think it's just inject and say goodbye, see you later? Absolutely not. That's when we bring in somebody to work on mechanics, somebody to work in on nutrition, somebody to work in on the pain psychology aspect of things. So it's one part.
It's a mental game. We talk so much about the mental game. Wow, the time flew. Dr. Tammy Penhollow, she's an osteopathic physician, regenerative medicine. Give us some insights, anesthesiology. Give me quickly again that website, Tammy.
It is precisionmedprp.com.
Thank you so much. Hold on quickly. Everybody, we'll be right back. It's the Sports Doctor.